So we're going to be talking about laser hair removal. I'm Dr. Shah, next to me is Renee, and Sarah. And we're going to be talking about this today. Before we get started, we'll talk about the science of laser hair removal. And basically what laser hair removal is the removal of hair by light that specifically targets the hair follicle. This local damage targets the dark matter of the hair, which is melanin. Now for some of us, this melanin is going to be lighter in nature, and that's called eumelanin. That's for those of us with blonde hair and red hair. For those of us with darker hair, which is called pheomelanin, laser is much more effective and will target that specifically. So, with that little background on laser, any thoughts on laser hair removal while we get started, Renee?
I think laser hair removal is an excellent way to help reduce hair on the body, anywhere on your body. The best hair to target would be the darker, coarser hair, usually Middle Eastern, Mediterranean hair. And
there's sort of a misconception about laser hair and laser hair removal and all that. Any skin colorations that you have difficulty with? Is there anyone who can't do laser hair removal? Someone who has darker skin, someone who has lighter skin. What are your thoughts?
So the toughest people to treat, I guess, what we can't treat would be your Fitzpatrick's like 1 and 2, because they have that.
And what does Fitzpatrick 1 or 2 mean?
A Fitzpatrick like 1 or 2 is like if you think about Nicole Kidman. So Nicole Kidman, she's very light skinned. She's got that green eyes, kind of reddish, blondish hair. So her hair is not a target. We cannot target that type of hair. So like our best,
and that again is going to be because of the eumelanin, which doesn't have the dark pigment, which is what the laser is going to specifically target.
Right. So like a really good candidate is somebody who has lighter skin with darker hair. That's like our perfect. That's our like.
Absolutely.
When I see them, I'm like, yes, we can definitely reduce your hair. Though with laser technology, we can treat Fitzpatrick's 5 and 6. We use Nd:YAG.
And Fitzpatrick's 5 and 6, again, for those of us at home, are going to be patients with darker skin. And all of us here, we're probably 4.
We're like 4, yeah.
Probably 4. So 5 and 6 would be a little bit darker pigmentation than everyone here on the panel.
Right. So with laser technology, we have YAG and a diode laser. Here in Dr. Shah's office, I use a diode laser very safely on patients with really dark skin. I have a method that I use, and it's proven to be really, really helpful for my patients. It does take longer because I have to lower the energy, and I only do 1 pass on darker skin type. So I will tell you it does take longer than, say, my skin to get that hair reduced, but it does work. Patients, I have patients that I'm treating for both acne and hair. That laser light really helps with patients who have like folliculitis on their face. I have a lot of women that come to see me with dark skin who have folliculitis on their skin, which is ingrown hair. So what is happening with that is their hair follicle is getting infected with bacteria. It turns into acne, and they have a full face of this. So what I always have them do first is see me for laser hair removal. We'll take care of that first, and then treat the acne. So the theory is getting that hair reduced so that hair follicle is not there to get infected by the bacteria. After that, we work on getting the skin like more even skin tone. So that's what I really love to use.
And I think when people talk about laser hair removal, it's not one type of laser.
Right.
There's really only like 4 basic types of laser that do laser hair removal. And one thing we're going to call a laser isn't technically a laser. That's IPL. IPL, I think, is not quite as effective for laser hair removal. Some of the studies show it near equivalent. I'm not as big a fan of IPL in laser hair removal setting. The other types of laser, there's an Alexandrite type of laser, dioid laser, and an Nd:YAG. And Nd:YAG is probably best for, it's suited for like dark hair and patients with darker pigmentation. So I like the diode laser as kind of the best overall laser. Now, if someone comes to you and says, I want to get treated, I want 1 session to treat me all with laser hair, turn the system up, will that work, Renee? And
I mean, if there is something out there like that, I mean, I would love that, but unfortunately, there is I mean, a minimum of at least 6 treatments is what I tell my patients, especially with the darker, coarser hair. Only because the way our hair grows in those 3 phases, it doesn't, it's impossible to get all of your hair in one session.
And kind of talking about the 3 phases of hair growth. So what Renee's talking about is our hair grows in 3 different phases, and those phases are the anagen, telogen, and catagen phase. And laser hair removal only works on the early phase of anagen. So if your hair is in a different cycle during that time, what's going to happen is it will not be targeted by the laser. So you're getting your hair at different cycles at different times. So you think a minimum of 6 sessions, would you say, is?
I mean, depending on, of course, the hair amount of hair, growth, but the majority of my patients, I've done a minimum of 6 treatments. Once you hit, I think, probably around 2 to 3 treatments are my patients, their feedback is usually, oh my God, my hair is growing back less. And it's like in spots, some spots, it's growing, and some spots it's not. So it's almost like a blotchy growth, which is excellent because we're getting there. So, but it does definitely, from my experience, take at least 6 treatments.
Now, sometimes you hear marketing terms of painless hair, like or pain-free hair, laser hair removal. Are there any ways you can make laser hair removal less painful and still effective?
Yeah, there are tricks that I do here in the office. Number one is I always tell them I'm going to press kind of hard into your skin with this tip because it kind of like numbs the patient. I also have a roller that I use that I keep in the freezer. I have the patient roll with that first, and then I go over the area. And we'll go about doing that on different parts of the body. If they request it, I will have that available to them. So it makes it more comfortable for the patient.
Yeah, I agree. We do have a roller that we use. It's really it's nice and cold, so the patient can actually roll that if she'd like, or he or she would like. But unfortunately, I believe that the more coarser the hair in certain areas, I feel like are going to be a little bit more uncomfortable. But we do try to make it as comfortable as possible by using the roller, and I like to put extra gel, like cooling gel, and that kind of helps also it makes it a little bit more comfortable. But
what about numbing gels? Do you think numbing gels help?
I personally use numbing gel on a patient of mine. We were doing his beard.
And for those that get out there, this is topical anesthesia. And which numbing gel were you using? LMX or using the laser gel compound we use for that?
I was using the compound.
And we have a specially formulated compound that we use for our laser patients, which it's fairly strong. I learned about it at a conference, and we have it specially formulated in a pharmacy. It takes about 30 minutes for this to work. And then what was the patient's experience using the topical gel versus those that don't?
So he had a lot of the ingrowns and stuff, especially on his neck area, and that was the main reason he came to see me. But we did do the gel, and I would leave it on for at least 30 minutes, wipe that off, and then right after go ahead and laser him. The first time I've treated him, I didn't use the laser gel, and the second and afterwards used the laser gel and the numbing gel, and huge difference. It was a little bit more tolerable. He was able to sit through it. He was fine, but it's a little uncomfortable either way you look at it. The numbing gel definitely did help, though, I would say.
And I think in general, I think when they talk about, I've heard of certain lasers being marketed as painless or pain-free. My back is sort of a pincushion of sorts because I think everyone always wants to test different lasers on it. And my back's been lasered multiple times when I have an opportunity. I think the lasers that work the most effectively for me are the diode lasers, and it seems to be more effective when it's a diode laser than another laser. I think when it's an IPL, it doesn't seem to. Maybe I'm not sure the pain goes down anything, but I don't think it's quite as effective. The ND-YAG, I think, is similar thing with. I think they're all about the same with pain. When it targets the hair and it hits the hair, there's a little bit of discomfort that you're going to feel, but it's well worth it. When you're comparing this to even things like waxing and other things, hair removal in general has a little bit of discomfort.
Yeah, I would say. I would have to agree.
Any things you can't do after laser hair removal? So someone comes in and says, I want to go on my trip to Mexico and I'm going in a week. What's your thoughts on that?
Fine, they can go wear SPF, have a good time. Yeah, because you know what, our laser that we have here does not cause injury to the skin if you're using it right. So if have the settings correct, which we're trained to do this, we have the correct settings, it does not cause trauma to the surface of the skin. So that same day that they get treated, I just tell them not to add extra heat to the skin, like don't go to the gym, don't add extra heat, because I already added heat with the laser. Just take it easy. But if they're leaving for vacation in a week, they're totally fine. Just SPF.
I wanted to jump, as far as doing any kind of laser before, like a vacation, before is fine. I think afterwards is where you kind of want to be careful. When you're on vacation and you come back and you have nice color and you're tanned, we're not going to get the accurate skin tone. So you definitely want to, I think, not be tanned when you come in. That's a big...
And again, that's going to go with the science of laser, which again, you want the difference between your dark hair and your skin so you can target the hair, believe it or not, and not the skin. So if you're darker, it's going to be harder for the laser to pick up that difference between the two.
Right.
So that's kind of the science behind it. So you're much more likely to have an adverse effect from the laser.
Right.
Can anyone do laser hair? What are some of the issues, like minimum qualifications you want to see in someone doing laser hair? Sarah?
I want at least 16 and over. And just some of the contraindications would be obviously somebody who's pregnant, somebody who's susceptible to seizures, because that, the laser light, any kind of skin disorders, like, if I'm treating somebody with eczema or like anywhere where there's a rash, that would be like a contraindication. Those are patients I wouldn't typically treat. Just have to wait until those things go away and then come see me. But definitely if you are susceptible to seizures and sensitivity to light, I would say that you're not a good candidate.
Yeah, I would agree.
What about, there's a lot of places doing laser hair removal. So why would one person go to one provider versus another? Do you pick it based on the laser? Do you pick it based on the provider? Is it a combination of the two? How much experience does someone need to do laser hair removal? Renee?
I personally think, you definitely want to go by somebody who you feel comfortable with, who's qualified, certified, and also has experience with laser and properly trained. Only because you can really hurt somebody with a laser if you don't know what you're doing. Also, I believe that the laser is an important factor here. I believe in the diode laser is an excellent laser for majority of our skin types here. So I've seen excellent reviews with it. So I look at all of the above.
For me, like my advice, I've seen patients come here coming from med spas where perhaps the esthetician was not properly trained. Because I've had patients who are coming to me and they've been they were getting plucked or getting waxed between their laser treatments. So that person that was treating them was not telling them the right information. What they should have told them was that you can only shave, so there's no plucking, no waxing while you're being treated during laser hair removal, because we're trying to target that hair follicle. And so what this patient was doing between her laser treatments was getting waxed and plucking. So her treatment was not effective at all. So she came to see me and she was like, wow, nobody ever told me that. So you definitely want to go see somebody who is trained, has been working with the laser for at least 2 years, and most importantly under a reputable doctor, just for safety reasons. There's, like Renee was saying, there's so much things that can go wrong. You want to have somebody that is following all the rules, like wearing glasses, have proper signage on the doors, and those are really good indications that the person that you are going to be treated with is professionally trained.
Any areas that, and it's becoming more popular in men, is becoming other areas of the body that are getting lasered. They're like, wow, they weren't lasering this 2 or 3 years ago. Do you see any trends happening?
With men?
Men, women, or any trends in the laser hair removal?
Well, women, I think we just, a lot of women are doing more of like full body, so they're hair free, like 100%. And men, men as well, but I think men are more with their contouring of like their beard, their neck, the back of the neck. And I don't think they knew that this was an option for them or this was even out there for them. So knowing that they don't have to worry about like ingrowns and stuff like that is an excellent, thing for men.
And what does it feel like, if someone says, well, why don't I just wax? What does it feel like for the laser hair patient? When they've had laser hair removal, let's say they've had 10 sessions versus someone who waxes. What does it feel like to the skin? What does it feel like? What does it look like? Is there any differences when you see someone? Can you tell someone who's had laser hair removal versus someone who has not? And any differences in how it looks?
Yeah, so somebody who has had laser hair removal, you can see that the skin is smoother. What happens is in certain areas of the body, and it's definitely depending on your ethnicity, you will see folliculitis, which is the ingrown hairs. So just depending, like I will see somebody who has like a ton of ingrown hairs and they've been being waxed. So it's basically when the hair grows back into the follicle. So with laser hair removal, we're weakening that follicle. That after like 1 to 2 treatments automatically stops. So that's really nice. So that's a big thing that I see with laser hair removal is the smoother skin, like that bumpiness goes away.
So you're avoiding the razor bump. So
Razor
it's going to be a
bump,
smoother.
yeah.
Any things you know, Renine, and someone with laser skin versus someone who's just a habitual waxer or shaver?
So before I was a waxer, before I started doing laser hair removal, I used to wax, and folliculitis was a huge issue. Just constant, ingrowns.
Especially with being Arab.
Yeah,
having
being
that thick
an
hair.
Arabic. It was constant ingrowns.
Yes.
I mean, and it's painful. It's not that great. And knowing that you have to do it like once a month or whatever it was, I'd rather get the laser hair removal done and over with.
I have patients that actually like how that feels, that laser sensation. You can feel it destroying the follicle, and they feel after they leave, they're always like, I feel so clean. Like it's like a renewal for them. Like they love to come to their sessions. They're excited. They know it's going to be a tad uncomfortable, but the overall, to see that hair growing, like, oh my God, it's been 2 months and I haven't had to shave this area. It's huge improvement, and the patient is always very happy.
And also, going back to like acne that you were speaking of earlier, it definitely, I feel like it helps with acne. So like doing laser hair removal on a patient with acne on their back or whatever it is, you see them and you'll see the difference the next time you come in, and they'll even tell you like, wow, my acne has definitely gotten under control. So
lasers, yay.
Yeah.
We love our lasers.
All right. Any other thoughts on lasers?
I just think it's a great invention. I'm thankful for it. I'm thankful to work in this industry that I can treat myself, I can treat my patients, and really they are so happy when they come in for the laser treatment. So it's just like a really good feeling to offer that service, especially with the laser that works. Earlier, Dr. Shah was talking IPL versus laser. So IPL is intense pulse light. It's a sporadic light. It's spread out. That's what you'll see in a lot of med spas because they're less expensive. And they're just easier to carry. So that's why a lot of med spas will carry them. But with our laser, it's a direct beam, killing that follicle, and that hair disappears faster. So I'm really thankful that I get to work with that type of laser because it's results.
And to have to shave less, why wouldn't you want to get laser hair removal anyways? I used to have to shave it every day, literally. And now it's like I can go on vacation. I'm hairless. So it's like I can go on vacation and I have to worry about it and spend longer in the shower. It's an excellent
I think it's like one less headache. I feel like less hair is more fun. That's the wave of the future.
That's it.
All right. Well, I guess that's a wrap on laser hair removal.
Thank you.